Good evening. How is everyone doing? Happy, what's day? Oh, this happy Thursday. Okay, so this is Trinette Stanford, and I want to talk to you tonight about celebration of life. Last night I came on and I talked to you about this is a new year, and usually with New Year's, we set up resolutions or we make promises or intentions or something to pursue for this year. So I was thinking about that, and another um in this calendar I look at, they have different celebrations that they list. And for January, the first week of January, one of the celebrations is celebration of life. And that is so appropriate that we want to celebrate life. And if you're not familiar with me, I work with women. I work with primarily women, but I work with men too. 40 years old and above, to um to fight or to take care of or to control, or whatever terminology you use, mostly diabetes, but any chronic health condition. And one thing I wanted to talk about last night and wanted to expound upon tonight is, are we going to just manage disease, or are we going to pursue health? You know, and my premise is what I would like to, that's one thing that I want to, I'm pursuing health. So when you pursue health, all of these other things will be taken care of. When you pursue health, then the different chronic health problems that you have, that's going to be taken care of. That is all encompassing. So last night, and I'm going to do a quick recap to bring you up to speed. Last night we talked about getting fast results versus lasting results. And so many times we go for the fast pace. We want something that's fast, and we want something that we see quick results. But the thing is, are they lasting results? Are those things going to um, last? If we lose 30 pounds in the next 6 weeks, is that 30 pounds going to stay off for the next 6 months? And see, that's what happens a lot of times with these fast weight loss things. We end up regaining the weight. Also, we were looking at lifespan versus health span. And a lot of times people say, well, I want to live to be 100. Well, that's all well and good, but how do you want to be? Do you want to be 100 years old where somebody has to take care of you, where somebody has to cook your food, lead you to the bathroom, and take care of your activities of daily living? That's what we call it in the medical profession, where they have to take care of feeding you and changing you and doing all those things. Or are you going to have a health span where you are going to be healthy and independent and able to take care of yourself? Those are two different things, okay? So that's why we want to celebrate life. And that is not something that just falls on us. It's something that we have to work at. It is something that we have to pursue and we have to actively participate in. So, what I want to talk to you about is making a blueprint for your life. And a blueprint is a detailed or a it's a detail or program of action that you will follow. And this blueprint is something that, number one, when you think about blueprints that they use in order to say, like you're building a house, it's written down. So that's the number one thing. You need to write it down. And one thing, and we talked about it last night, one thing we talked about was making sure that you had a journal that you kept, that you keep track of things in. You use that journal in order to keep track of your weight, in order to keep track of your blood sugars, your blood pressure. And I was in another meeting earlier, and um, they have a medical journal. And this medical journal included in this, you write down all the medicines that you're on and what they're for, write down your doctor's names, all the doctors that you see and their numbers. Also, you want to list out your family history. You know, what kind of health problems are known in your family? Is there cancer on either side of your family, on your mother's side or your father's side? Is there diabetes? Is there high blood pressure? You know, all of these things. Because when you look at family history, whatever your parents and grandparents had, a lot of times you are apt to develop those same things. So that's why it's important that you keep track of these things. And I also recommended that when you part of this journal would be a calendar. And on that calendar, I like the calendar part of it, because then that way you can write your blood sugar, your blood pressure on that date. So then you can look back at a glance, and look and see how your blood pressure and everything is running. Also, the purpose of that journal is when you go to your doctor, when you go to the doctor's visits, you have that with you. So then that way they can see what has been going on with you since the last time they saw you in the office. Case in point, a lot of times people's blood pressure is higher in the doctor's office than it has been than when they check it at home, because of anxiety. Or, like, for instance, I went to the doctor the other day and my blood pressure was up higher, but she had gotten me, I had, because at this particular office, you had to sit in your car and wait for them to call you in order to come in. So they called me on the phone. I had to walk from the parking lot into the office, into the exam room, and right when I sat down, that's when she took my blood pressure. So, of course, my blood pressure was up a little bit because I was walking kind of fast trying to get in. So, when you have a record of what your blood pressure has been running at home, that is something that they can look at and determine that, okay, this person's blood pressure is doing okay on what they're doing, on the medicine that they're on. The same thing with the blood sugars. Um, you need to, especially with your blood sugars, write your blood sugars down and the time that you've taken your blood sugar. So then that way they can see how your blood sugars are running at home, and to see if you need to have a change in your treatment, if you need to have a change in medication, because a couple of things. If you see that your blood, hey Willa, how you doing? Um, for instance, with your blood sugars, if you say, you know what, I'm really feeling bad with this medicine. When I take the medicine, I really feel sluggish, and then they're able to look at what your blood sugar has been running at home, and then that way they can make adjustments in your medicine. Because a lot of times when they're looking at your A1C, and the A1C is the reading that's taken every 3 months, and what it does, it shows how well your blood sugar has been controlled over a 3 month period of time. It gives them a big picture. Whereas looking at the blood sugar number in your lab test, and when in the book, that's like a snapshot. It's for that period in time. So, taking all of that together, they're able to make decisions about how you need to make adjustments in your medicine, or how you need to make adjustments in what you're eating or in your activity. All right. So that's why it's important that you keep track. One thing there has been a change in the way we practice, because before, we go to the doctor and we sit there and let them tell us what to do, and then that's the end of the visit. But that's not the way it should be. All right, you have to be a participant in your care, because you are the expert of your body. You know what goes on with you. So that's why you need to present your point of view, and that is with that journal, that is with that notebook. And also, you let them know what you have been doing, how you have been feeling. And that is, then all of that is taken into consideration in order to help the doctor or the nurse practitioner, whomever you're seeing, develop a plan of care. And especially at this point in time, because things are really hurried, unfortunately, because of the pandemic, because of the upswing in COVID. there's um there are some things that have a tendency to get overlooked. So unless you bring attention to it, it may not get attended to. Case in point, a friend of mine who's also a client, her brother was having some issues. So hi Frida, um, he was having some issues. So he tested positive for COVID. They treated the COVID, but after the time of isolation, or the period that he should have been feeling better, he was still feeling bad. And so he was telling her his symptoms. So then she called me to find out. And I said, well, he needs to go back in. He needs to go see his doctor and, make sure that he gets tested for the flu and to see what else is going on, because he described the symptoms. I said, well, something's going on. So he needs to get checked out. So then um, sent a picture of his urine, and it was really badly discolored and everything. I said, there's something going on that's serious, and he needs to get it checked out right away. Unfortunately, when he did go in, he had blood work done. They called him and admitted him to the hospital. Sad thing was, he had pancreatic cancer. And the thing about pancreatic cancer, a lot of times, by the time you start having symptoms, it's too late. There's nothing really that they can do. And like I said, because of the pandemic, because of all the attention with to COVID and everything, a lot of times all other things are getting overlooked, or they're not being pressed. And because of people fearing to being exposed to COVID, they're not going to the doctor like they should. And they're ignoring symptoms that need to be addressed, that need to be taken care of. Excuse me. So that's why that's a long way of saying that you need to be an advocate for yourself. You need to make sure that you speak up and you tell your provider what is going on with you, what you're feeling, and what concerns that you have. And you don't just tell them. That's why you have the journal, in order to show them what your blood pressure has been doing, what your blood sugar has been doing, what your weight has been doing. Because, you know, like for instance, in the case of this gentleman having cancer, his weight was dropping. So if he had had that record, they would have seen, hey, there's something going on, because his weight is decreasing. Okay. So that's why you need this blueprint. We're calling it a blueprint for life. And we want it to be detailed, program of action. That's one part. You document those things, but then also write down what your plan is. What is your goal for for your health? And I know a lot of times we do it for a year, but let's put it in short. let's look at a short period of time. If we can put it for 3 months, and I say 3 months because that's usually the amount of time between office visits, to have your A1C. So for 3 month period of time, set your goal for 3 months. Set your goal about how are you going to eat, or if you're going to exercise, and if you are, how often. What are you going to do in order to improve your health? That is something that you have to determine. All right. But those are some areas that you need to look at: exercise, what you eat, how you eat, also sleep. All of those things are important. So you pick out one um, one or two things in order to concentrate on, in order to improve your to address your life, so that you can improve your health span. Okay, so that's what I wanted to talk to you tonight about, was setting up this blueprint for your life, which is a detailed or program of action for what you're going to do. Okay, so and I recommend, like I said, have part of it being a calendar and another part in order to keep track of all the other information. You need to, and in order to recap, write down the names of all your doctors, um, when your last visit was. Write down the names of your medicines and who prescribed them and what the dosage is. Also, write down the name of your pharmacy. All right. I always recommend that you want to stay with one pharmacy. You don't want to have prescriptions. You don't want to be getting prescriptions from 5 or 6 different pharmacies. All right. You want to stick with one pharmacy. And then also family history. It's important to put down family history. Another thing that some other things that need to be written down in this journal: when have you had a colonoscopy? When was your last colonoscopy? If you're female and you still have your uterus and everything, when was your last pap smear? When was your last mammogram? If For men, and for those of you who have spouses or significant others, when was the last time they went to the doctor? And sometimes we as women need to encourage them to go to the doctor like they're supposed to, especially when they're older. Because, like I said, I work with women 40 years old and above, and a lot of times the men are older also, and especially um, people of color. If it's a male involved, make sure they get their prostate checked. That is so vitally important. It's life saving. And not just getting a PSA blood work done, they need to have a physical check done. So that's another thing. So, in addition to you taking care of yourself, if you have a significant other, if you have a spouse, make sure that they get taken care of too. All right. Okay, so that is it for tonight. I want to thank you for taking time in order to spend time with me, because you could have been doing anything else, but you took the time to listen, and for that, I'm very appreciative. Um, if you see that website on the bottom of the screen, what that is, there's a challenge that's going on, and I'll keep it current for another week. And what it is, it's a 30-day challenge where we're working with a nutritionist in order to, excuse me, to upgrade the way we eat. So if you go to that website, it will give you some information. And if you are interested in enrolling, shoot me an email. Not an email. You can shoot me a message, a direct message, to let me know, and I can get you in. But it's really good. It's for 30 days, and what it does is upgrade your nutrition, where you be eating better. All right. It's not a diet. It's not a detox. It's not a cleanse. You don't have to count calories, and there's no elimination of any foods, but it's just promoting healthy eating. All right. So if you're interested, let me know. All right. So that's it for tonight. If anybody has any questions, like I said, make sure you can leave me comments below or you can send me a message in Messenger. Everybody have a great night, and I will talk to you later. Bye.